Have you ever noticed a strange dark patch on your neck that wasn't there before? Or maybe your skin has become unusually dry, itchy, or prone to infections that take forever to heal. Most people brush these things off as minor skin problems. Maybe it's aging, maybe it's the weather, maybe it's just one of those random things the body does as the years go by. But what if your skin is actually trying to send you an early warning message about something happening deeper inside your body? For many men over the age of 50, subtle changes in the skin can sometimes be one of the first visible signs of a much larger health issue, something that often develops slowly and quietly over time. We're talking about diabetes mellitus, a condition that affects how your body manages blood sugar and energy. The tricky part is that diabetes doesn't always begin with dramatic symptoms. Many people expect things like extreme thirst, constant urination, or sudden weight loss. But in reality, the early signs can sometimes appear on the skin long before someone even realizes their blood sugar levels are rising. Your skin is actually one of the largest organs in the body, and it often reflects what's happening internally. When blood sugar begins to climb too high, it can affect circulation, nerves, and even the way your immune system responds. As a result, your skin may start to change in ways that seem unrelated at first. Darkened patches, frequent infections, slow-healing cuts, or unusual itching can sometimes be subtle clues that something isn't quite right. And here's why this matters. Catching these warning signs early can make a huge difference. When diabetes is recognized sooner rather than later, people have far more options to manage it and protect their long-term health, energy levels, and independence as they age. In this video, we're going to talk about some of the surprising ways diabetes can show up on your skin, why these changes happen, and what your body might be trying to tell you before more serious symptoms appear. To understand why your skin can reveal early signs of diabetes, it helps to think of your body like a finely tuned engine. Blood sugar, or glucose, is one of the main fuels your engine runs on. When it stays at a healthy level, everything hums along smoothly. But when blood sugar begins to rise too high, especially over months or years, it can create friction inside your system, starting with your blood vessels, nerves, and immune responses. Your skin, being your body's largest organ, often acts like a dashboard, showing the first warning lights that something is off. One key reason for skin changes in diabetes is the way high blood sugar affects circulation. Glucose can stick to proteins in the blood vessels, making them less flexible and slightly inflamed. This subtle damage reduces blood flow to the skin, which is why cuts may heal more slowly or infections linger longer than they should. Imagine trying to water a garden through a kinked hose. Some areas don't get the nutrients they need. That's what your skin experiences when circulation is compromised. Another factor involves your nerves. High blood sugar over time can affect the tiny nerve endings under your skin, causing unusual sensations like tingling, numbness, or itchiness. You might not realize it at first, but these sensations often accompany other skin changes. Certain areas, like the feet, hands, or lower legs, are especially vulnerable. Then there's the effect on collagen and skin elasticity. Collagen gives your skin its strength and resilience. When blood sugar remains elevated, it can interfere with collagen production and damage existing collagen fibers. This may lead to dry, rough patches, thicker skin in certain areas, or darkened patches known as acanthosis nigricans, commonly seen around the neck or armpits. Your immune system is also impacted. Diabetes can reduce the body's ability to fight off infections, meaning fungal infections, bacterial infections, or persistent rashes can appear more frequently. Even minor irritations can become stubborn, leaving marks or scars that take longer to fade. In short, the visible changes on your skin are not random. They're a reflection of what's happening internally with blood sugar, circulation, nerve health, and immune function. Recognizing these signs early can give you a real advantage in protecting your energy, performance, and overall health as you age. Now that we understand why diabetes can show up on the skin, the next step is figuring out what to do about it. The good news is that many of these skin changes can be managed and sometimes even reversed when blood sugar is brought under control and the body receives proper support. The key is a combination of awareness, daily habits, and targeted strategies that address both blood sugar and skin health. The first and most important step is monitoring your blood sugar. You don't need to become obsessed, but knowing your fasting blood sugar, or HbA1c levels, can help you catch changes early. This is the foundation, because every skin symptom you notice is really a reflection of internal blood sugar imbalances. Once you know your numbers, you can take practical steps to stabilize them. Nutrition is at the heart of this approach. Foods that are low in refined sugar and high in fiber help keep blood sugar steady. Think whole grains, legumes, vegetables, and moderate portions of lean protein. Incorporating healthy fats like olive oil, avocado, or fatty fish can also improve insulin sensitivity and reduce inflammation in the skin. For example, a breakfast of oatmeal topped with chia seeds and berries paired with eggs can give sustained energy without spiking blood sugar. Lunch could be grilled salmon with a generous serving of leafy greens and quinoa. These meals don't just support your skin, they support energy, brain function, and overall vitality. Hydration and skincare are equally important. Dehydrated skin becomes dry, itchy, and more prone to infections. Drinking plenty of water throughout the day, using gentle cleansers, and moisturizing with products that support the skin barrier can prevent irritation. For men over 50, consider creams or lotions with natural oils like jojoba or almond oil, which can nourish without clogging pores. Avoid harsh soaps and hot showers that strip natural oils from your skin, as these can worsen dryness and make diabetes-related skin issues more noticeable. Movement and circulation also play a vital role. Regular exercise improves blood flow, insulin sensitivity, and helps nutrients reach the skin efficiently. Even a brisk 20-30-minute daily walk can make a significant difference over time. For men experiencing early nerve tingling or circulation issues in the feet, adding gentle stretching or foot exercises can improve comfort and mobility. Some targeted supplements may also be helpful, though it's important to discuss these with a healthcare professional. Vitamin D, omega-3 fatty acids, and certain antioxidants can support skin health and reduce inflammation. Probiotics may help with gut health, which in turn can influence blood sugar control and immune function. The goal isn't to rely solely on supplements, but to use them strategically alongside food, hydration, and movement. Paying attention to infections early is another critical step. If you notice persistent fungal infections, slow healing cuts, or unusual rashes, address them promptly. Clean the affected area, keep it dry, and use over-the-counter antifungal or antibacterial treatments if appropriate. Persistent or severe cases should be evaluated by a doctor, as they could indicate more significant blood sugar issues that need medical management. Finally, consistency is everything. These strategies don't provide instant results, but over weeks and months, they help stabilize blood sugar, improve skin appearance, and enhance energy and overall health. Think of it like tuning an engine. Small, steady adjustments make a big difference in performance and longevity. By taking a proactive, daily approach, you're not only addressing skin signs, but also supporting your body's long-term resilience, vitality, and performance well into your 50s, 60s, and beyond. Even with the best strategies in place, many men over 50 unknowingly make mistakes that undermine their efforts to manage blood sugar and protect their skin. The first and most common mistake is ignoring early signs. Don't be that guy who brushes off dark patches, dry skin, or slow healing cuts as just aging. These seemingly minor changes are often your body's way of signaling that blood sugar is rising or that circulation and nerve health are being affected. Ignoring them only allows the problem to grow quietly. Another mistake is relying solely on topical treatments or creams. While moisturizing and skincare are important, they don't address the root cause, blood sugar imbalance. Applying a cream may temporarily relieve dryness or itching, but it won't prevent the underlying issue from progressing. For real improvement, you need to stabilize blood sugar through nutrition, movement, and lifestyle adjustments. Skipping regular checkups is another trap. Blood sugar levels can fluctuate silently, and many men assume that feeling okay means everything is fine. The reality is that diabetes can develop gradually, and symptoms may appear only when the condition has already started affecting nerves, circulation, or organs. Simple blood tests, done periodically, can catch issues early and allow you to take action before complications appear. A fourth mistake is inconsistent nutrition. Some people try to eat healthy one day, then indulge in sugar-laden foods the next, thinking it won't matter. But for managing blood sugar and preventing skin problems, consistency is key. Even occasional spikes can trigger inflammation, slow healing, and worsen skin changes. Small, steady habits are far more effective than short bursts of discipline. Neglecting exercise is another big error. Movement isn't just about weight management. It directly improves circulation, insulin sensitivity, and the delivery of nutrients to the skin. Skipping daily walks or stretching can slow progress and make it harder for your body to recover from elevated blood sugar. Lastly, ignoring infections or unusual skin lesions is a dangerous mistake. Minor fungal or bacterial infections can quickly worsen if blood sugar is high. Don't wait weeks hoping they'll disappear. Early intervention protects not only your skin, but also your overall health. Safety considerations are also important. Before starting supplements, changing medications, or dramatically altering diet, it's wise to consult a healthcare professional. Certain supplements may interact with medications, and rapid blood sugar changes without guidance can be risky. Avoiding these mistakes ensures that your efforts are effective and safe, giving you the best chance to restore skin health and maintain energy and vitality. Let's wrap this up and bring everything together. Your skin isn't just a protective covering, it's a window into your overall health. For men over 50, subtle changes like dark patches, dry areas, persistent itching, or slow-healing cuts can often be the earliest signs that blood sugar is creeping up and that diabetes may be developing. These signs aren't random. They're your body's way of sending important messages about circulation, nerve function, and immune health. The good news is that by paying attention and taking action early, you can protect not only your skin, but your energy, performance, and long-term health. Practical steps like improving nutrition, stabilizing blood sugar with consistent meals, staying hydrated, exercising daily, and supporting skincare with gentle moisturizing can make a real difference. Supplements like vitamin D, omega-3s, and probiotics may help, but they work best when paired with lifestyle habits. Monitoring blood sugar and addressing infections promptly are also key to preventing complications. Here's a simple challenge for you. Over the next week, take a close look at your skin. Check your neck, armpits, hands, and feet for any unusual changes. Pay attention to dryness, dark patches, rashes, or slow-healing cuts. Track your energy levels and note any tingling or unusual sensations. This simple exercise will help you become more aware of what your body is trying to tell you. If you notice anything concerning, schedule a checkup or get a blood sugar test. It could be the first step toward long-term protection. I'd love to hear from you. Have you ever noticed skin changes that turned out to be related to blood sugar issues? Share your experience in the comments below. Your story could help someone else recognize the signs early and take action before serious complications occur. If you found this video useful, make sure to like it, share it with someone who might benefit, and subscribe to the channel for more science-backed, practical health strategies designed for men over 50. Save this video so you can return to it as a reminder, and let's take control of our energy, performance, and long-term vitality together.